So here I am to present like what after Farm Week doing internship in videos. Like once we complete our 150 days of internship, some people will be having plans to do internship outside. So I'm just here to give you an idea how it works outside in other hospitals. For example, we've taken Cytecare. So as I'm connected with Cytecare, I did it there. So I just wanted to give you this information how the outside internship works and what are the things we'll be able to learn there in other hospitals. So again, from hospital to hospital, it varies. But in specific to Cytecare, what all if you are trying to go there, what you can learn, I'll just help you out with information. So it will be like duration, it will be 3 months. So if you're planning to split and do local Karnataka people, you need to do 90 days compulsory in a single place. If you split and do it, again Farmers Council of India will not agree. So again they'll send you back when you go and apply. They'll send you back to complete in one organization only for 3 months. I mean 90 days completely. You can't split. But in case of other people like Nepal and other people, so it's not mandatory for them. They can do in 1 month in one place and other 2 months in other place. They have that option. But local people, they don't have that option. So, Cytecare Cancer Hospital and it's also Cytecare Multi-Specialty Hospital also. This was first launched by one of the pharma industry, one of the pioneer called Farzan Engineer, the person who is in blue color tie there. So he is the chairman and the founder. So other people are the co-founder. Towards the left hand, second person is the Suresh Ramu. So he is the CEO of the Cytecare. In the center, it is Vajubai Valagaru, so who was the honorable governor, ex-governor of Karnataka, when the Cytecare was opened, almost 7 years by now. So this coming November, they'll be completing 8 years successfully. So we have one more co-founder for Anthony Pais. He is also one of the breast oncologists, one of the top breast oncologists. So Himanshu, these are all people basically from the pharmaceutical industries. So they had this special intention to bring up a cancer specialized organization to give a special care for the cancer treatment. So that's the reason they started Cytecare Hospital, especially only for the cancer. But now they have converted it as a multi-specialty. You can see their back side, the Cytecare, where the C symbol has so many dots. So each symbol means a cell. Cytecare is a treatment that they are going to give importance for each and every cell. So their concept was that they care for each and every cell of the body, and that's how they care for the patients. Okay, I did my internship there for 3 months. So during my 3 months, I was able to interact with many people there, learn many things. So we had one medical camp also when I was doing the internship over there. So I think most of you people were part of that medical camp also. So what I learned over there, like what all you people will be able to learn, it's chemo drug mixing and the administration. This is the basic. We people as a clinical pharmacist, CP, we know here our senior Delvin is also there. He'll also be doing the drug mixing. You people would have seen it. So it is the main job. What CP we get there is the first important job is the drug mixing, chemotherapy drug mixing. So you'll be able to learn the brand names, different varieties of brands will be there. Like different companies will create their own brand names. Generic name will be the same, but again the brand name will be different. So some particular patients specifically prefer a particular brand only for their, for their treatment. So we should be aware of all the generic names as well as brand names. Non-chemo medications will be used in chemotherapy. We have those examples. I'll just show you that future. So patient counseling, we have the opportunity in Cytecare. Not in all other hospitals we have this opportunity to give the patient counseling. Usually we are not allowed, but in Cytecare we have the opportunity to give the patient counseling. And there is a biosafety cabinet. So this cabinet is where the drug mixing will be done. We have one such cabinet even in this Baptist also. So IP audits and OP audits and the crash card. So these three are specially audits which will be done by us. I'll explain in brief what is all that. So chemotherapy in the drug mixing administration. As a clinical pharmacist, we'll be removing the exact amount of the chemotherapy drugs from the vials. So there will be a doctor who will be preparing the dose, like what particular dose should be given and what are the quantities. So sometimes how we are supposed to mix it. So like some adriamycin and all these drugs will be there. They are all in the powder form. We need to convert them into solution form. From then solution to we need to again dilute it with NS or RN, whatever the preference the doctor suggests. We need to inject that into that particular medication. This is adriamycin. Adriamycin is a red color. So here when we are going inside this cabin to do the drug mixing, basically we are supposed to wear the head cover as well as the surgical gown kind of thing, and we'll be wearing 3 layers of gloves. One is the non-powder gloves, first layer. Again, there will be 2 layers of powder gloves. So after wearing 3 layers of gloves, and we'll be wearing N95 mask only. So actually, we can see here only one. Actually, back next to this, there will be one more cabinet where the medications will be kept by nurses in that particular cabinet. From there, we'll be opening it and taking the medications, and we'll be doing it in a sterile way. And drug disposal, just there only we'll have the small cabinets where we will be discarding all the waste or whatever the extra unused drugs are there. We need to discard it as per the standards, like how we need to discard it. So yeah, the clinical pharmacist will verify each product and make sure to be germ free. So whenever after we mix also, even the small droplets of the, when we mix now, usually this hydramycin, this drug, no, that bottle will be air compressed bottle. Whenever we try to prick or inject something or take out any sample, no, it will sometimes, because of the air compression, it will just eject. So that time there will be a chances of drug spilling out also. We need to make sure before we give it or hand over it to the nurses, we need to clean everything. With the swabs will be there, alcohol swabs, we need to clean clearly, and because there will be sometimes, even they will also use the gloves to touch. All the chemo medications will be handled with the special care with the gloves only. In bare hands, we don't have permission to touch any chemo medications. So these are the multiple brands which we use in Cytecare. So we have some examples over here. I've just enlisted when I was there in Cytecare. So for example, we can see doxycycline, that is adriamycin, we have in 2 different doses. Doxycycline 10 mg and doxycycline 50 mg. For example, doctor may write 40 mg. So that time we will be ordering 10 mg of 4 vials. So we can't order 50 mg because 10 mg will be whenever they want in immediate use. Okay, this is the biosafety cabinet which I was trying to speak with the people. So as I said, see, let's say we have a separate container. So usually there will be a separation between that door, left side door, and that huge thing. The 2 white color where we see is we will be putting our hands and we will be mixing the drug over there. Like left side cabinet is the one where the nurses will come and keep the drugs. So there will be a small door kind, transparent door. We need to take the medication in a sterile way, mix it up, and we need to give it in the other way. Actually, we were supposed to have the another place to send the medication out. It is like a cycle procedure. When the medicine comes inside, after mixing, and all the waste should be dropped down there, and the very good mixed drug to come in from the right hand side. That is how the procedure works. Here, due to some space issue, we are not sending from the right side, again we are sending it back from the left side. So this is an isolator and a air divider, clean air provider, complete separation between the aseptic procedure. So where this complete machine works as a great barrier here, it doesn't allow any germs or any kind of infected air every day after the cost. So this is outpatient audit. Even the outpatients also we will be we will not directly have the interaction with the outpatients, but we will be doing the audits of the prescription. Whatever the prescription is doctor has written, we will be having this access for the soft copy. Like all the doctors, whichever the patient has got the appointment for today, all that appointment list will be sent from the medical head to the CPT. So it will be divided for certain people. These many doctors should be handled by different CPs. So they need to do the audit of each and every prescription doctor has written. If doctor has made any mistakes, any dosages or any kind of errors, we can't directly inform that to doctors. We need to inform that to the medical head. So further, medical head will try to interact with the doctor and get it reported or corrected. If not, then if it is anything serious, then she will be sending the complaints email. So whenever we are reporting this OP audits, it should be very careful, because all the doctors there, like not only in any hospital, doctors easily don't take any mistakes easily. So before we send or raise any complaint or mistakes identifying, we should be much careful on that. TAP and patient data cross check. So this data cross check is like sometimes doctors do, it's all systemly updated, date, age, everything. Sometimes there are this kind of small errors of date and age mistakes that doctors do that will be identified. So this is one of the major thing where we have the opportunity as a CP, especially in Cytecare, that is crash card. Everyone knows that crash card will be there in the almost in emergencies, it will be there, ICUs it will be there, operation theatres it will be there. It is there even in the daycare also. So in Cytecare, especially this crash card is handled by the CP team only. We will be going cross-checking the medications. Hardly every week we will go and cross-check. But whenever the medication replacement should be happen, so near expiry medication should be replaced, or whether it is kept as per the sequence, we have the labeling over there done. Okay, so whether is it done the label properly and medication is it in the correct place. When crash cart, no, everyone knows that crash cart is used during the emergencies when some sudden code blue or heart attack things happen. No, suddenly this table is dragged over there for the all the medication is accessible easily and help the patient to recover. So this particular auditing and maintaining this entire thing, not only in the daycare, in all the ICU, even in the dialysis room also, we have the opportunity. So we will go do audit regularly and we need to document that also. If there is any error there, it is our responsibility to make updation over there. So this is what we do usually in Cytecare. Apart from this area reporting and all, what we do here, no, the same thing, interventions, areas, everything will be done there also. So compared to other hospitals, Cytecare, we have this special opportunity that they are giving more opportunity for CP people to go and explore. So when it comes to Aster, no, we will not have so much of Aster because most of our seniors have done that. They don't have the opportunity to drug mixing also, but they have the opportunity for ward runs. I've heard they'll be going for some outside like camps and other things. Even Cytecare also suggests you people to go for outside this thing also. Cytecare people even give you the fund to do the clinical research. So if you people are interested, they have a special research team, some research programs and all. So you people, Cytecare will be funding there for doing the research, but you will be agreemented under the Cytecare to do that research and all. Such kind of opportunities are there. So people who are completing your family, if anybody is interested for post BBH internship, you can please visit Cytecare. And thank you.